Becoming a lesbian parent can be really quite a challenge, and socially and culturally we don't really have a story available for how lesbians become parents. It's a very sort of uncharted territory, if you like. Lesbian couples have to ask themselves questions like, how do we do it? How can we access donor sperm? Do we go to a clinic? Or do we do it ourselves with maybe a friend or someone who's willing to do it for us? And it used to be that lesbian couples didn't have access to clinical treatment in the UK, which meant that there is a long history in amongst the lesbian community of self-arranging donor conception, as they're using a friend and doing it at home. In recent years, clinics have become much more available for lesbian couples. However, it's very, very expensive to go to a clinic for sperm donation in the UK. So that means that actually the informal routes are still very common, and loads of people choose to use a friend or someone maybe off the internet. Both the clinical routes and the self-arranged conception route actually raises an awful lot of questions to do with who is the donor, how do we choose a donor, do we want him to be an involved father in the family, do we want him to be known but not very much involved, do we want him to be someone that the child can find out information about when it's older, when he or she is older, or are we quite happy for the donor to be completely anonymous and for the child never to know about him? For couples who conceive in a self-arranged conception arrangement, they also have to manage the fact that they're actually going to be very intimate, or have a sort of very intimate exchange with someone that they probably don't know in that sort of context. And managing that kind of intimacy and actually receiving the donation at home can be very difficult. Donor conception also, though, raises questions around family and who is seen as a family. And these mothers